I am Antonio Contestabile, University of Bologna, Italy. There is increasing evidence that in neurodevelopment, in physiological development, and in pathological alteration, epigenomic regulation plays an important role. So I would like to ask if you think that the proposal to study normal epigenomic regulation and alteration in animal models of autism or other syndrome would be an asset to the program?
I think this would fit perfectly. I think epigenetics are a critical part of shaping the brain. So I think this is still very much an emerging field, but it has already been shown that this is a critical part of autism, of the autism brain. So yes.
Yeah, my name is Álvaro Ramírez. I represent the European Autism Public Health Alliance, as well on behalf of the Instituto Carlos III Madrid. As IAFA, we have been working the last year in coordination with the DG Sanco and the European Agency, the Executive Agency for Health and Consumer, in making a diagnosis of the standard of care across Europe. And we have a panel of experts in March in Luxembourg, and we have 2 sub-regional meetings with participation of 36 countries, where we have the description of the standard of care across Europe. And we are at this moment preparing the report where we can see the difference on first diagnosis, for instance, in Latvia. The first diagnosis in autism spectrum disorder was in 2006. Yeah, then since then, the curve starting growing up. Our situation like in Romania, where children are still being sent to orphanage, or other countries where the prevalence that is reported is about 2%. Then we're going to present the results of this exercise with DG Sanco in November 29th in Dublin, in the final conference of the European Autism Action Plan. This result will be the base of the European Autism Public Health Plan for 2020. We're planning to target to have a strategic vision on where we see this initiative with very much interest and a lot of expectation about the possibility to work with this and really to incorporate into this public health plan supported by DG Sanco the concept of what will be in the IMI initiative. The other aspect is clear in the parents and families organization. There is a lot of apprehension about the role of the pharmaceutical industry, and there is a view of the pharmaceutical industry that need to be worked in order to make this effort as well more palatable for the families, because they are very scared about the drug development, and there will be an issue that we will have to consider as well, other issues that came from the work that we have done this year about other medical conditions, other comorbidity that will need to be addressed, not only the neuro pharmacological issue. Thank you.
Okay, well, thank you for your comments. I think on the first part, I wasn't aware that this initiative was there, so I'm really eager to hear what the result of that is, and I'm not sure if we can. No?
We have to see.
Okay.
Maybe you can participate.
Yeah.
I mean, go at least.
Yeah. And then secondly, on the awareness, I can see. So I'm a parent myself, so I can share the concern of giving my children medicine, but it's with the awareness that this is a disease and not a condition that cannot be treated. I think this is an assignment where we have to see on how we want to develop drugs, and also they have to bring very clear benefit. And I share the thoughts that is a field, a very difficult field, but I think if there is a possibility, then we should be looking into that.
Yeah. I would like also to add a comment. I think that if you remember the presentation of Michelle Goldman this morning about the fact that really one of the specific aim of IMI is to make projects that are patient-centric. I think really for this topic here we have a unique opportunity to do something like that, starting from the beginning. And I mean, this is, let's say, a little bit of an advantage that we are starting from a position where there is really not a strategy out there. So maybe it's the chance to make it right and start by involving all the stakeholders, including with a very active role of patient and patient organization and working together on that.
Only a little comment on this, because I think it's important starting with the right foot. When you mention that this condition is a disease, you do that into parents' organization, you do that into the community with ESD, they will throw you out by the door. They will think, this is a condition, this is a situation, and they don't like to be considered ill people. They want to say, person living with autism, and it will be a huge political risk, starting categorizing this as a disease.
Okay.
Hello, my name is Jeffrey Glennon. I'm at the Donder Center for Neuroscience at the University Medical Center St. Radboud in Nijmegen. So well done actually pronouncing the name correctly. I think that's the first thing I should congratulate you on. But I can understand the perspective from what you're saying, because I spent nearly 10 years in industry at Solvay Pharmaceuticals as a behavioral and mechanistic pharmacologist. I have one brief question, which is, do the companies expect that proprietary compounds are tested by the consortia at the stage of clinical trials, or even that there are maybe proof of principle studies done for some of the mechanisms of action that are under investigation?
So like I stated in my, my presentation, this is pre-competitive. So what we're not going to do in this consortium is test compounds, right? So what we want to do is provide the context in order to allow us to do that in Europe. And that will need, you know, this concerted effort that we're trying to do. So all the way from research to patients and anything that's in between, including regulators.
Will, I have two questions, a preclinical one and a clinical question. The preclinical question is this one. My company makes instrumentation for the automated measurement of behavior and physiology in rats and mice. And I was wondering if there is a particular preference from the EFPIA members for certain animal species to be considered in the animal models. You're asking for novel animal models. Does that mean rats and mice, or does it also mean primates? Or should we take into consideration when we are developing animal models the ones that will be supported by pharmaceutical industry or that can be executed by pharmaceutical industry? For instance, if you have the consortium, the FPI members have all closed down their primate centers and we come up with innovative primate models, then that may not be of no help for you.
I think it will be mainly rodent models, if not exclusively. I think it will be very difficult to have a primate model. There have been some let's say, approaches to develop primate animal models, but I haven't seen any primate model to evolve to a stage that I would think it has any predictive validity. That's a personal view, but if there are, certainly this could be considered. But I think, to answer your question, I think this will be rodent models.
And a particular, say, preference for rats or mice, or is that up to us to propose?
Well, obviously the various models. I mean, there's the valparate model in the rat that obviously is there, but mainly we're looking at mice, I think, because we're looking at transgenic lines.
I was just going to add another perspective. I would say that the shift in...
Cooperate with the mic.
You guys can hear me, right? Or
That's for the recording.
there's clearly a shift in terms of the dominant logic for what premiums are placed on animal models in industry towards those that are leveraging the human genetics. And so that narrows our focus to mice, but doesn't take completely off the possibilities with rats today. So I think there are efforts to do marmoset transgenesis and other, there are opportunities there, but that's why I think there's a greater premium placed on the rodents, because it allows us to leverage a genetics effort from a mouse model all the way to a patient population carrying that same genetic mutation or chromosomal abnormality.
Okay, and my second question was the clinical one. The other half of my company makes software for human observations, behavioral observations of, say, patients during the task performance, or naturalistic observations in a home setting or in a simulated home in a laboratory. And in the past 5 years, we've been amazed by the uptake of these tools in the United States for autism research and also practical diagnosis. And we've seen, say, organizations that we never used to do business with, like healthcare organizations and hospitals, massively using these tools in the routine diagnosis of patients for autism spectrum disorder, they say diagnostics and treatment. We can learn, of course, a lot from their experiences, and we have contacts with all these groups. Would it be, say, recommendable to do so and to propose, say, best practices that have proven themselves in the United States in the clinical work package for this IMI call?
Well, the answer, of course, is yes. If anything that has been developed elsewhere, we should consider, and if tested and considered viable and implementable, then this is something that we should bring forward and use in Europe. Yeah, we shouldn't invent the wheel for the third or fourth time, right?
Hi. So I'm curious whether you have considered merging a phenotype and genotype from all the GWAS data that is already available. It seems to be missing that part of human genetics in the working package, if that was, on purpose, or if there was any kind of, strategy behind it, or because someone else is doing it, maybe, I don't know. And then the second question is more related to the governance. Like you said, the isolated groups could be a problem. And looking at this, I think it's easy to see how the groups could be working on their own thing and relating to the top, but not transversely. And so I'm curious whether you expect people to include resources or financial resources or human resources to work around this.
Well, first of all, like I said, we have to be proactive there. As the project coordinator, I have to be proactive here and make sure that there's an alignment. Having worked in academia for a while, as well as in a pharmaceutical company, I know that sharing of information is always a critical factor. There is a role for the leaders of the work packages, right? So these are the two, the EFPIA and the academics. So there's a proactive role. And then, of course, there needs to be a willingness and an attitude in sharing information as soon as possible. The work package 5 is basically around this, and to see how we can implement that. What we don't want, like I said, and what you're highlighting, is that we want to have these work packages working in isolation. And there, because that's just a pillar then. So work package 1 feeds into 2, feeds into 3, feeds into 4, and that will then make a strong consortium. Yeah. And on terms of genetics, the genetics is not highlighted in this call because we feel we have now more than 250 genes, I believe. Now, the next 100 may be very, very important, but that's not what we want to do. What we want to do is make the next step. Do you understand? And the next step is, I think, is what we're trying to propose here.